Riddle me this, Batman. What is one of the most common comorbidities with autism? Now, psychologically, we're looking at ADHD, depression, and anxiety. But physiologically, the meat suit part, stomach issues, gastrointestinal issues. But why? Why is this such a common comorbidity with autism? Why do so many people on the autism spectrum have issues with their gut? Like, this is super common. Like, not quite like part of the diagnosis, but golly, it just about could be. So there are three main culprits that scientists believe are responsible for the stomach issues. The first one, and actually one of the more logical ones, is actually that the gut-brain access in the brain, like the gut-mind linkage there, is somehow disconnected. Basically, one of the theories is that a lot of people with autism, their brains and their stomachs don't communicate very well, and so it doesn't get the proper signals, so digestion and things don't happen in an appropriate fashion. So that's really interesting, which also that means that's something that we could theoretically, with like mindfulness practice and a few other therapeutic techniques, actually help to strengthen that pathway and re-engage that pathway. So that's fascinating. It's something I'm going to be looking into. Thing number two is some researchers have found that the actual gut biome of the autistic individual is different. Now, is this because of the brain-gut linkage? Is this because of other things? Like, when are they researching this? Are they getting people when they're adults? Are they getting people when they're kids? Because, like, you can't just, like, have a baby and be like, I don't, autism, yes. That usually happens at least, like, a minimum of, like, 2 years. So by that time, there's already been some stuff going on with the preferential eating and things like that. Which leads me to the third thing. Food sensitivities, specifically textural and flavor sensitivities and things like that, are a big issue. That's why things like eating disorders like ARFID, avoidant restrictive food intake disorder, are very common with those with autism. And oftentimes many autists will prefer to consume things that are reliable and consistent, which usually means processed, because you can have 2 pieces of broccoli and they'll taste completely different. You can have 2 wheat thins and they'll taste exactly the same. Or goldfish or dino nuggies. You get the point. Processed food is consistent, natural food is not. And because of the tendency to want to pursue consistency, the actual nutritional intake is not as good. Oftentimes processed food is not good for the tum-tum. Natural food is. And therefore that could be one of the other factors. So now there's some interesting things that you know, and I need to go deep dive on this whole gut-brain access thing, because that sounds like a cool lead and something that I as a therapist can do something about.